hoye! Waziri hoye! Hoye! Governor wetu hoye! Hoye! Our chief officers hoye! Hoye! Our CPHOs hoye! Hoye! Our KEHPHPU hoye! Hoye! Are we ready? Yes. Solidarity forever! Solidarity forever! Solidarity forever, for the union makes us strong. Again, solidarity forever, solidarity forever, solidarity forever, for the union makes us strong. We shall never be divided. We shall never be divided. We shall never be divided. For the union makes us strong. Now we can talk to the press. Members of the fourth estate, I think after I finish, Waziri will speak. Then Danny can say something. Maybe. Yeah, thank you. Can I go on? Yeah. Comrades, power. Power. KEHPHPU hoye. Hoye. Governor Kwale hoye. Hoye. CPHO hoye. Hoye. Waziri wetu hoye. Hoye. Chief officer hoye. Hoye. County Public Service Board hoye. Hoye. Yeah, thank you so much, members of the fourth estate. My name is Brown Ashira. I'm the National General Secretary and the CEO of Kenyan Environmental Health and Public Health Practitioners Union. This is a union that is representing all the registered and practicing public health officers and technicians in Kenya. Comrades, power. Power. Our work on daily basis to make sure that we bring down disease burden. We walk around to ensure that none of our community members fall sick. We make sure that we do sampling, we do food and water quality analysis. We bring down disease burden so that the monies that the government use expensively to put up hospitals, to put up very expensive medical equipments, can otherwise be used to be able to set up, to be able to build roads, give community members water and other things. So today we were in Kwale for a very important function, courtesy of the Waziri and the county government of Kwale. We are actually here to discuss how we can be able to sign a recognition agreement between KEHPHPU, that is the Public Health Union, and the county government of Kwale. Comrades, power. Power. We want to thank, and this one I want to be very categorical. I want to thank Waziri, I want to thank the chief officer, I want to thank the CPHO, I want to thank Governor Achani for actually embracing public health interventions. Comrades, power. Power. Right now, I think, for a record, the county government of Kwale has employed public health officers, close to nine PHOs that actually we have actually been able to sit down with the county government of Kwale. We have managed to employ 9 PHOs. And in addition, the county has actually promised to employ an additional 20 public health officers in Kwale County. It must be understood that Kwale County faces a glaring shortage of public health officers and technicians in Kwale. Comrades, power. Power. And therefore we want to appreciate the governor, we want to appreciate the chief officer, we want to appreciate Waziri, the entire county government of Kwale for employing PHOs and for embracing public health interventions. Comrades, power. Power. Number 2, we want to thank the county for supporting PHOs. Actually, for a record, they have agreed to facilitate our colleagues. I think we're actually doing a lot of motorbikes, we are doing a lot of utility cars, because our work entails to do surveillance. You cannot do surveillance when you're moving around to track down diseases without facilitation. And therefore, Waziri here has promised that they're actually going to provide motorbikes, they're going to provide vehicles, and they're going to facilitate our colleagues to be able to work with a lot of ease so that we can be able to bring down disease burden in Kwale County. And I want to say this for a record. For the past, like, I think 2 years, we have not had instances of cholera in outbreak. 9 months. 9 years, sorry, 9 years. We have not had instances of cholera outbreak in Kwale. And if you see people not falling sick, don't think that it's happening from heaven. We have people, the PHOs, who are actually working very hard. We want to thank the Waziri for supporting us, because those cholera issues, those typhoid issues, those communicable diseases have not been happening because public health officers have been fully financed. They have been fully facilitated to be able to take care of what they're supposed to be able to do. And that's why we are asking humbly that we maintain this. What we are asking humbly is that we fast track the issue of signing of recognition agreement, and we make sure that we employ more PHOs, particularly the degree holders, comrades power. Because we have had our graduate colleagues who have gone to school, they have languaged in lecture theaters, doing public health at the degree level, at the master's level. We have not managed to employ them. We want to ask humbly the Kwale County government to consider employing them so that they can now also be able to utilize that skill set, because the degree person has a different skill set from a diploma and a certificate person, so that skill set can be used for the benefit of service delivery for the county government of Kwale. So at this juncture, I want to invite Waziri to say words of wisdom, and then we can, after Waziri speaks, we can have our branch, and maybe one national leader and then a branch leader, maybe to say something. Comrades, power. Thank you so much.
Okay, thank you SG. Kwa majina mimi naitwa Dr. Francis Gwama Mwatsavu, nikiwa waziri wa afya gatuzi la Kwale. Kwanza kabisa wenzangu, ningesema pokeeni salamu kutoka kwa governor. Najua leo tumekuwa mmechangamkia Kwale, but hii yote ni kwa sababu ya uwiano na upendo, na ilikuwa ni mazungumzo ya pamoja ili tuweze kuendelea mbele, na sisi kama county government tukiongozwa na